Welcome back to our afternoon session. To start it off, I would like to invite Dr. Natalie Kwan, emergency physician and trauma fellow from Hospital Sungai Buloh, to present her topic on integrity and ethics.
Hello, good afternoon, everyone. I hope you all had a good lunch. Okay, I think some are not back yet, but we'll just get through a very dry and boring topic of ethics and integrity. You guys must be wondering why we have to do this, right? But ethics and integrity is one of the important things when we are collecting data, and it's also very important for us in the future when we want to use the data. So whatever yang we are doing now, like all this MTR, and you want to, set up in your hospital, you want to start recruiting MOs, your nurses, PPK, siapa yang nak do this, you are buying your computers to key in your data. So this is something new, that this is all at the base setup. So it's like kalau you tanam pokok bunga or you're planting a tree, so this is just putting the seeds in and you're not seeing the fruits yet. So when the tree grows and you see the fruits, that's when you are reaping your fruits, and that's when you will get your data to do research. So I want to do research or how many percentage of polytrauma, how many percentage of head injuries, what are our survival rates. Those are the important things where ethics and integrity will come in. Right. Oops. No? No? Okay. We'll just go a bit of overview on what is ethics. So ethics is a system of moral principles of rules and behaviors. Okay, how many people in this room thinks they are ethical? Angkat tangan. Okay, I only see a handful of hands. So means the rest are not very ethical. Okay, so how do you define what is ethical and what is not ethical? So that's not an easy thing to do, correct? So that's why we have like bodies to govern. So macam kalau you have like WHO, in certain countries you have their own ethical. Kalau you those who are in university, you have the ethics committee, your MMR. So the study of what is morally right or wrong. So when we think about ethicals in research or ethicals in medical conduct, kebanyakan masa kita akan go back to Nuremberg Code. What happened in kalau I think some of you will have watched the movie before or not. I'm very young, so the movie actually came out in the 1960s. So some of you will have heard it before. It's called Nuremberg Code. Nuremberg Code is what happened in US, where they came and they did a trial of World War II war crimes. So no need to know, just know that who lived through World War II here? Tak ada kan? Alright, so it's like another history class. So what we need to know that is important is from the trial, and their conclusion is voluntary consent is very important. So voluntary consent means whatever things that you do to your subject in medical research, you need to have voluntary consent. So if we apply it back to our settings, dekat MTR, does your patient has consent? So do we get consent for the data? No, we don't get consent from our patients. But where do we get the consent from? The hospitals or the ethical committee in your hospitals, or in this case, whichever body that governs us, like the PIK. Right? So another important thing is also unnecessary physical and mental suffering, which in this case, if in MTR, the suffering and physical, mentally suffering already happened, so it doesn't apply to us. So this Nuremberg Code is actually tells us what worldwide has been using this. It's telling us like what are the ethicals, what you can do, what you cannot do, and what you should do. Another one is the Bellman Report in the 1978. So this is what happened in America, is they took all the latent syphilis patient is in a Tuskegee study. So this patient with syphilis symptoms, the latent syphilis, and they will track the patient 30 to 50 years. And if the patient does develop active symptoms or have complication, they actually withheld the treatment. supaya they can continue to see how much worse can the patient be. So imagine kan, if you have a disease and you have a complication, and when you come to the hospitals, the doctor don't give you treatment. So for syphilis, the latent syphilis, or if they have a flare, you can actually give them penicillin, which was already available. But the researcher in that group decided that no, we shouldn't give them because we want to see how much more severe can the disease go. So if you think about it, you're actually causing mental and physical suffering to the patients. So when the report was, it's a 50 years, it started in 1930. So the report came out somewhere in 1972 and they caused a big uproar. So by 1978, they come out with 3 core principles of studies where you have to respect the person, and whatever studies that you do must have benefits and it must make justice. So that is the important thing where when you collect data for your MTR or for any other research that you do in the future, or in the future, whatever data that you want to publish, then you always have to think of this. Do you respect your patients as a person? Does it benefit? So whatever data that we get from now, does it going to help you to reduce the incidence of trauma? Or how is it going to help benefit a certain treatment actually reduce the mortality or morbidity of the patient? So these are the things that you have to keep in mind. So research issues that you're going to come out with, or people going to ask you in the future, maybe not now yet, is there a need for consent to use the data? Is there a blanket consent? So the data that we collect now is for MTR, but in the future, you might collect data for many other things else. And when you put it into research, can it be used? Is it a blanket? Can the individual opt out that they don't want to be? Or is there a right balance between societal benefits? So for MTR, the big issues that are going to come is between privacy and property. Privacy, what do we mean by privacy? Anyone here pernah kena credit card fraud tak? Anyone? Tak pernah. I'm sure you all kena before, right? Have Hello? Lisa? Okay. Have any one of you got call from banks recently within this month? Call from Maybank ke, Citibank ke, HSBC ke, saying that you ada tunggakan berapa or something, or you get a call from lembaga hasil dalam negeri that you tak bayar tax, that you have tunggakan. Pernah kan? Okay, so these are data leaks. How did they get your phone number? How did they know some of them, when they call you, they know you by name. Hello, Dr. So-and-so, or hello, Miss So-and-so. So these are all called data breach, and your data has leaked out lah. Your name, sometimes your IC number, maybe your birth date, your phone number. Sometimes they have your alamat surat menyurat. So when we collect data for our patient, the privacy and the property is an important thing. So when there's a data breach, the privacy of your patient will be breached because you're going to key in like the details of your patient, how old, the date of birth. So that's why issues like this are actually very important. And data security, which was and cyber security, which was presented yesterday, that's where it come into hand. So when we have a MTR, is very important, or not just MTR, any registry for the matter of fact, we must make sure that the data is very well protected to protect the privacy of our patient. Then the next question will come to property. Who owns the data? So kalau Hospital Seberang Jaya key in the data, does the data belong to Hospital Seberang Jaya? Boleh tak hospital lain tengok? Boleh tak, let's say Hospital Tower, I want to see what's the incidence risk of hip fracture in Hospital Seberang Jaya. Can somebody else look at it? Can we compare data, like what's the incidence of polytrauma between Hospital Melaka and Hospital Johor Bahru? So these are the data owners. So if I key in the data, does it belong to me only, or does it belong to everyone? So there must be a balance between the privacy, the property, between education, and also research. So we also want to know, like, you don't want to protect the data. Oh, data ni saya punya je. I'm not going to share it. I don't allow it to be shared. So when you don't share the data, then we can't do a research. We can't say like the total incidence of polytrauma in Malaysia, because every hospital wants to keep their data. So the incidence of traumatic brain injury is a secret to my hospital. I cannot share it with anyone else. So when everybody is withholding their data, so we don't have a national data. So there must be a delicate balance between sharing and privacy. Okay, so the principle used for research, like I said just now, the important thing is data security, data confidentiality, the permission to use the data. So that's why if you're wondering why macam susah sangat kita nak, apply pun kena ada CHOP ketua jabatan. Dah lah HOD very busy, right? Then you have to submit in. Your PA also making noise. Why do you have to have all this CHOP? So these are the security part that the KKM is doing on their side to make sure that only approved personnel can key in the data so that you don't get fabricated data, and also only certain people can extract the data. So that's what's important. That's their job to do it. So this is the data security. And so for MTR, what do we do? How do we ensure that the data is safe? So first, by screening through who can put in the data, who can put the input, and also at the back end, they also screen through who can extract the data. And then you have this me tag, right? Which is actually a big headache. How you want to go in, your phone numbers, your MOH. So that's the tools that they put in so that we can protect our data. And you guys are coming here for training, so that's part of it as well. So confidentiality should be held to the highest standard of conduct. So things like auto-logging off, and then protocols to de-identifying encrypted, make sure no public access, only certain personnel. So those are the data confidentiality that the PIK or the ones who gave us the database, they are the one that has to put in all this security. And then the permission. So that will be when the tree that we are planting is growing. So after it grows and it has fruits, then we need to start asking for permission. So maybe let's say hospital Kuching. Okay, I want to do a study for Borneo only. So Kuching, the whole Sarawak, they want some data, and maybe they want some data from Sabah state as well. So they want to do that, and so they have to write in a letter, put in a proposal, and get the permission to extract the data out. Then also we want to use it for ethical appropriate use. So whatever research that we want to use, make sure it's done appropriately. So the next big part of it will be integrity. So integrity and ethics is always interchangeable. Sometimes kita rasa it's maybe the same thing, but the integrity for this one is we are talking about the quality of having a strong moral principles where there are integrity of research and the research integrity. So the research integrity is talking about your research. Macam mana you design your research, how it's done. That's where the methodology is important. Okay, in this room, saya nak tanya, siapa tak ada GCP? GCP, siapa tak ada? So, semua ada If everybody has GCP, then that's good for you because you will need GCP when you start doing research. So whenever we submit in all the research or any publication you want to do, you will need to have GCP. So that's why we make sure the integrity is protected. Okay, so the researcher's integrity is important as well because then the community or the social will need to respect and trust. Then your research will be a promising one. So the key elements for integrity will be honesty, rigor, transparency, open communication, care, respect for all participants, and accountability. So if you are a researcher, so whoever's sitting here, if you are a specialist in your own specialty, ataupun you're medical officers, but you're going to be a specialist one day, so you will be a researcher one day, and then you will have to be responsible and to maintain the standard of your research. So whenever you want to do a research, the methodology cannot be cincai. So we have to follow the steps. Who are the patients that we recruit? Who are the data that we can take in? Who are the ones that we are going to exclude? So the employees of the research, or those people that will have to be responsible for the integrity, maksudnya KKM lah in this context. So KKM's responsibility is to maintain our research environment, a culture of research integrity, and that's why they are supportive. So they always ask you to submit papers. CRCs are one of the big bodies that will help a lot of you when next time you want to do your research. That's why orang CRC will always be there to support. So get them to help you. So a good research environment will be clear policies. So like just now what Dr. Sarawanan said, just ikut the protocol, ikut the policies. But at the same time, you need to get training. Baru you can understand the protocol and policies that are in place. And you need to have a robust management system as well. Sebab if not, if you will get either too restricted ataupun there's no restriction and all your data will be leaked and then your patients won't be protected. So this is the end. I think I will not put all of you to sleep anymore. So research misconduct, if some of you have heard before, maybe not so much regarding a registry. It's about registry, you're just collecting data and analyzing them. Tapi when we do like a medical research, whether it's you're just collecting data based on observation, or you're actually doing active arm of whether you have a placebo and an intervention, then that's where a misconduct can come in easily. And sometimes when you are not having a strong ethics or the integrity is not strong, you will feel waiver. Like let's say like for dengue, to bring in your subject, the inclusion criteria is your BP must be less than 120/80. So this patient's BP is 121/81. Boleh tak? So that's where it's going to come, like, or your nurse will ask you, oh doctor, for this whatever research, the BP must be less than 120/80. Our patient is 121/82. Nak include ke tak nak include? So these are the things that are going to waiver. Or our research is taking all those who are non-smokers or they have quit smoking for 2 years and your patient quit smoking 1 year, 11 months ago. Nak ambil ke tak nak ambil? So things like that. Sometimes fabrication, you make up your results. I think this making up result is one of the very popular misconduct is if you have heard, the MMR jabs that cause autism, that actually really spearhead all our anti-vaxxers. Yeah, so this is one of that. Although subsequently, I think 10, 20 years later, we said that it's fabricated and it's not true, but whatever damage is done has already been done. Same will happen to your research if you are not careful with it. So about the moment you publish and it's available to everyone, people can use it even 20 years later. So falsification, manipulation, plagiarism, sometimes we don't have ideas, so kita curi je idea orang lain. So be careful with that. So that's why it's always important to, before you do your research up the topic that you want to do. And then failure to meet legal or ethical obligations, misinterpretation. I think all the EPs here or all the other specialists, if you have done your dissertation or your thesis in your masters, you will know sometimes misinterpretation of data is very easy, kan? When you have the data and then in your discussion, how you want to direct your audience. You want to go towards this way or you want to go towards the other way is how you write it. So sometimes when you are at the position where you are the lead researcher, it's very easy for you to misinterpret and thus you bring it to the wrong conclusion. All right. So another important thing is if your staff is bringing up that there might be improper dealing of allegation of misconduct, so you have to pay attention to that.